So it's so interesting to see the common themes that we have in terms of like supportive networks and personal experience, shining through the stories that we've heard, and it's the same for me as well. I was diagnosed with major depressive disorder in medical school, and I had a very interesting, I would say interesting because in the context of Nigeria, you rarely find the kind of supportive system for someone that has a mental health issue. But I had very amazing friends and a support system that actually made it possible for me to see through that difficult time in my life. And that was essentially the inspiration behind me starting up my organization, Mentally Aware Nigeria Initiative, because I was looking to create that kind of community that I had for myself. I wanted to replicate that for other young people across Nigeria and across Africa. And till today, we've had like the most amazing growth. We're the largest user-led youth mental health organization in Nigeria, one of the biggest ones in Africa as well. We have more than 1,500 volunteers on the ground across 18 states in the country, which is amazing. A fantastic online presence as well on social media, which is very interactive. We co-create programs with young people, programs that get them interested in talking about mental health. We have conversation cafes in very lush places like the beach and the park and waterfronts, because these are places where young people want to be, to talk about, have very difficult conversations like, what do you do when you're dating someone with schizophrenia, bipolar disorder? How do you communicate? And we've had more than 25 of these events with more than 20,000 young people in attendance in the past 2 years. We also have the largest and most active crisis support system, which uses the text-based platform. It's not crisis text line, but it's much like the one we shout. We've had more than 15,000 interventions in the past 2 years. And obviously this has redefined my thinking in terms of how we can create support systems using the kind of network that we have, that the internet has provided us, making sure that young people have access to support whenever they need it and not having to like look out for that.